She went from being pretty much ambulatory to almost needing a wheelchair. As the Alzheimer's was progressing, she was becoming more and more debilitated. And they saw those needs, and they actually provided a wheelchair for her until we could get one. So that was great.
So this is my mom. She's talking about my grandmother, who we called Grandmommy. Grandmommy had Alzheimer's. She went to an adult day healthcare center in California. And recently, people online have been talking about fraud around these types of programs. They've been saying that these types of centers are scams. Do you remember any of the activities that she did there?
Well, the one I was the most impressed with was the physical therapy. They actually had a physical therapy room with those bikes, which was exercise and really good for her. She enjoyed that part. She was an athlete. She'd been a basketball player in high school, and she liked doing the bike. So I was very impressed that and there was supervision by a physical therapist.
Adult day healthcare centers, they gave my grandmommy a longer life, a better life. And I want to be very clear. She deserves better than to be treated as a political punchline. The adult day healthcare program is one of the most well-regulated in Medicaid across the country. So if my mom ever needed to go, someone else in my family, I wouldn't hesitate to enroll her.
Thanks, Mom.
What we're going to do is we're going to go visit some centers, see what that might look like. You want to talk about fraud? Let's see what fraud prevention looks like.
Hello, welcome, come on in. This is the light blue one, yeah.
So what is all this stuff?
This is just part of the paperwork that we have to complete for getting somebody enrolled into the program.
And what else do you have to do?
Well, once we get an application from somebody, we have to do eligibility verification. We have to get information from the physician, clinical assessments. We need to develop a care plan, and you name it. There are really a number of steps that we have to continue to follow.
So every family has to go through this?
Everybody who's enrolled in the program has to go through this.
That's the part you don't see online. The paperwork, the compliance, the care from staff and management, people taking care to make sure they can keep older folks safe and secure. When my grandmommy was declining, she just needed a safe place. Adult day healthcare centers provided that safe place. And they provide that safe place for 45,000 Californians currently. So what happens if something doesn't check out along the way, the enrollment process?
Well, if something doesn't check out, if somebody doesn't meet the eligibility criteria, we just aren't going to enroll them, because we have to be very careful that people meet the criteria and that we can serve them and help them as safely as possible.
So it's not easy to enroll someone in an adult day healthcare center through Medi-Cal, meaning this program is very protected from fraud. Now, how easy is it to open up one of these centers? So some people think adult day health cares are easy money, that you can just game the system. So today, if you were to open this center, how long would it take?
So it would take at least 3 years from all of the different state agencies, licensing, fire inspections, and you have to hire your entire staff.
So we're talking about a staff that includes registered nurse, social worker, occupational therapist, physical therapist, all sorts of credentialed professionals, right?
Exactly. Everyone has to be background checked. If they are licensed or credentialed, they have to have that as well as being trained. And then in addition to that, you have to supply to the state your staffing and the staffing pattern, the hours that they're there. So they all have to be on site and be being paid this entire process.
So you have to have fire code signed off, ADA compliance, managed care contracts, health department sign off, All of this before you can have a participant in the building.
Absolutely. And as a reminder, this is Medi-Cal rates. So the state defined rate has gone up 0% since 2006. So this truly is a work of heart and a work of art. It's not a profit-driven industry. This is something that we do because we believe people should be able to live independently with dignity in the community with the support that they need to do so. And it saves taxpayer dollars.
These are not get-rich-quick schemes. More than 9 in 10 centers face regular financial losses because reimbursements don't cover costs. More than half face medium or high closure risks. These adult day healthcare centers are barely staying open, and yet they strive every day to serve their communities. When an adult day healthcare center closes, and make no mistake, they are closing, 29 have shut their doors since 2020, a family loses the only place in their community that they could safely care for their loved one. That's a real person going into a nursing home who didn't have to. We welcome accountability. We welcome oversight. What we can't accept is misinformation. California's most vulnerable seniors deserve to age with dignity.